This is an almost hopeless situation where the patient has had severe decay and a lot of gum problems and needs to decide between will she someday have a denture or if she would like to take care of the teeth so that she would be able to have them the rest of her life. 53-year-old female, and we'll see the decay that's up there on the upper right. You can see the dark spots, and then she has a couple root canals on her front teeth, and then some significant decay on the lower left. Now we'll look at her mouth, and she has been to a dentist semi-regularly is her description, but hasn't been any care for the last 2 years. 2 years ago she said that she had a deep cleaning or a thorough cleaning of her teeth, and you can see how her gum tissue is really irritated and red, and she has a lot of tartar and calculus around her teeth. Also on the edges of the teeth you can see the wear that she's had. She's chipped some teeth in the edges, and I'm going to put a little air there around the teeth, and you'll actually see the gum tissue just kind of falling away from the teeth. And that typically is what happens when someone doesn't floss their teeth or get them cleaned on a regular basis. Here's a close-up of the chipping areas, and you can see the black tartar, the gum tissue being blown away, and you can also see the tan or yellowish plaque and tartar there as well. Okay, that's tooth number 18. You can also see the tooth in front of it has some cracking and chipping along the edges. She's also flattened out her teeth from grinding in this area as well. Eventually she had knocked out the filling and went ahead and the decay continued. You can see the soft decay that's there, and it just peels away. The tooth is truly is hopeless. Certainly someone could try and be heroic and try and do a root canal and a post and core and a crown lengthening, but that's truly not a good situation. Same thing in the lower right. You can see where she's ground down here, chipped this area. She does have active decay on those two teeth, but those teeth are probably salvageable. See the crack in the filling, that's up here. And that's what happens when someone's bite is not corrected and they're not able to keep track of their teeth very well. And we'll see later that she's not touching her front teeth at all. She has what's considered an open bite. I'm going to take a peek at the back of the lower front teeth. You can see how the gum tissue is purple there, and all the extra tartar. Teeth, though, are not mobile. And take a look at her front top teeth. You can see the bridge on the right side. When she closes, there's a space. She's not touching any of her front teeth. And we're just seeing where she actually touches. There isn't a really good foundation when she bites down on the teeth. And you can see the tartar and the purple gum tissue. And it's truly one of those situations that if she doesn't decide to take care of these teeth, she's going to eventually lose them all. Back of the upper front teeth. See the purple gums around all the teeth, but particularly around the bridge as well. Some significant large fillings on the upper left. You see the plaque and the tartar back there. What's the other side, the upper right? That is the side that she's bridge is solid. See the wear on the front tooth there. And then in the back upper right. Looks like a crack also on the premolar right here, and there, and there. Get a real close-up of that. You see that when we go and remove that filling, we'll get an idea of that. Here is the food that's been caught here, decay. There's actually a silver filling that's loose, and there's decay that's up inside here. And rather than having it taken care of right away, it's taken, I'll let that filling just be there, and as a result of not getting the work taken care of quickly, she's ended up having decay occur in the tooth in front as well. So both those teeth are hopeless, and she will end up losing them. You can see with the filling out, and then on the inside here, up underneath there, is deep decay on the root of that first molar as well. And you will see how there's all sorts of decay underneath here. You can see this white chalky area. And that's on the root of that tooth as well. And effectively not seeking treatment right away has caused her to lose both teeth. The decays into the area of the nerve really is quite hopeless. Would be a good area for possibly having a implant for that first molar. But the patient needs to decide if she wants to save her teeth or not.